introductions just to get everything moving along. So as you guys probably noticed, Rachel is not here. She had her baby about 2 weeks ago. So that's wonderful. Everybody's healthy and happy and they're enjoying being their full family together. So she's out on leave for a couple of months to spend some time with baby. And then Jeanette is out on personal leave for about a month. So she should be back by the next ROSC meeting and for the recovery walks. And then also Nadia has a sick kid at home. So she should be joining by the end of the meeting. So I'll be kicking things off here. I'm helping out with the ROSC while all the transitions are going on. So I'm Randy Wilson, community health specialist at Chestnut, typically working on the Regional Leadership Center project in Logan, Mason, Menard, and Sangamon counties. So if we could just go around, I'll call on people. If you could just give your name, position where you work for. So Nell, if you go first, please.
Hi everyone, I'm Nell Hurley. I am the consultant for supporting you all in the creation of and sort of implementation of ROSC Council. Thanks.
Grace, you're next.
I'm Grace. I'm a prevention specialist at Chestnut Health Systems. So basically, Tyler and I work together. We are focused in Logan and Mason County. We go into schools, teach youth prevention education, and help with the coalitions on events and anything else that needs to happen.
Excellent. Thank you. Tyler, you're next.
Yeah, so like Grace said, her and I work together. We're a substance use prevention provider for Logan and Mason County. We work for Chestnut Health Systems, like she said, as well.
And then Jenna.
Hi, I'm Jenna Fox. I work for Family Guidance Centers in Springfield, Illinois, and my title is ROSC Manager for Sangamon County.
Thank you for being here. Deborah.
Hi, I'm Deborah, and I've been in recovery for 26 years.
Excellent. Thanks for being here. Carrie.
Hi, everyone. My name is Carrie Knapp. I am also a community health specialist with Chestnut Health Systems, and I work under the Regional Leadership Center project along with Randy.
Thank you. Erin.
I'm Erin Brown, and I'm the Child Protection Supervisor out of the Lincoln DCFS field office.
Excellent. Samantha.
I'm Samantha Martini. I am an addict in recovery, and I am just here to help.
Awesome. Thank you so much for being here. Everybody that's just joined on, we're just going around. I'm calling on people, introducing themselves and the organization they're from. So Kim, you're up next.
Kim Turner with Logan County Probation.
Josh.
Hey everybody, my name is Josh Christ, and I'm with SIU School of Medicine Center for Rural Health and Social Service Development.
Thank you. Marcia.
Hello, Marcia Cook. I'm the owner of the Moksha Center Holistic Wellness in downtown Lincoln.
Thank you. Sue.
Hi, everybody. My name's Sue Tisdale. I'm a overdose prevention person, whatever you want to call the label, community educator, I'm sorry, with Unity Point Health Unity Place, covering 14 counties.
Excellent. Thank you. And then Angie.
Okay, hi everybody. I'm Angela Stoltenberg with the Abraham Lincoln Memorial Hospital Community Health Collaborative. Happy to see some new faces today and some that I recognize.
I know we got a big group today. This is awesome. And then last person we have is Andrew. So he has a longer introduction. So I'm going to pull up a PowerPoint for him and he's going to introduce himself.
Hi guys, my name is Andrew Crouch. I work for Family Guidance Center here in Springfield, Illinois. I'm also the community outreach for Hub and Spoke. And so I have a PowerPoint that I'm going to present to you guys, let you guys know about Hub and Spoke, because currently Logan and Mason County are covered in the Hub and Spoke grant. So it'll be a little bit more specific during my PowerPoint, just a kind of a quick rundown about me. This is my 10th year of working in the substance use disorder field. I'm also in long-term recovery as well. Initially I started off as being an adolescent counselor working for Gateway Foundation, working with their 13 to 20-year-old population in residential. Then I moved over into their medicated assisted treatment program through the STR and SOR grant, really focusing on the jails. And we were doing Vivitrol at that time in the jails. And then I left Gateway in 2019 and went over, started working for Crossing Healthcare at their Crossing Recovery Center over in Decatur at the new treatment center that they built there. I stuck around there for about a year, got their program up and going. And then I wanted to go into private practice. So I went and did private practice for a while, working in a private MAT clinic where we did buprenorphine and methadone there. And then I got tired of being chained to a desk. So I started coming over here to Family Guidance Center. I wanted to do more community outreach work. I wanted to be out in the community, kind of working with individuals, getting people into treatment and bringing services to counties who don't have a lot of services there. So here I am. And like I said, I'm going to give you guys kind of a rundown of Hub and Spoke. I tried to simplify it as much as possible because there's a lot of information in regards to Hub and Spoke. So me and Jenna Fox, she's been very helpful for me. She's my ROSC manager here in Sangamon County, and she was doing Hub and Spoke before I came here as a recovery support specialist with Hub and Spoke. So she's kind of been teaching me, helping me along the way, because I just started this position on July 6th. So I'm fairly new to Hub and Spoke. So I'm still kind of learning a lot more about it. So like I said, I invited her to this too, because, she's doing some really good things here in Sangamon County with ROSC. And, I think working together, guys, we can kind of accomplish some goals that we have in place just by networking and different things like that. So starting off with the PowerPoint, did we get everybody? Randy, has everybody been introduced? Can we go into this?
I believe so, unless more people came on. Yes, I believe everybody's been introduced, so you can go right ahead.
Okay, cool. All right, so this is the Hub and Spoke model. This is what it kind of looks like. So the hub is the high intensity MAT, which could be methadone, buprenorphine, naltrexone, regional locations with all staff specialized in addiction treatment. So Family Guidance Center is the the hub. And then the spokes are going to be any type of service that has any type of maintenance, MAT, with buprenorphine or naltrexone. Community locations, they have a lead provider there, a nurse and support staff to kind of support it with. And what we do is we'll exchange information with patients' information and consultation along with training. You can change the slide, Randy. Thank you. Okay, so what is AMAR project? AMAR is access to medication-assisted recovery. I think they kind of changed it up. It was MAT, so now they've, it's kind of gotten a little bit different now. Now we're focusing on medication-assisted recovery. AMAR network models, the Hub and Spoke, are being implemented in areas of Illinois that are currently have relatively few treatment resources for persons with opioid use disorder. They call them MAR deserts. A hub is a regional opioid treatment center responsible for coordinating the care and supportive services for patients who have complex SUD and or co-occurring mental health conditions. Patients who need methadone must be treated here. A spoke is a primary care practice, specialty practice, or health center responsible for coordinating the care and support services for patients with opioid use disorders who have less complex medical needs. Only patients who are treated with buprenorphine or naltrexone receive treatment in these spokes. Depending on the patient's needs, supportive services may include mental health and or substance use disorder treatment, family supports, life skills, job development, and recovery supports. And so this is what the current map looks like for Illinois AMAR network, okay? And so it's kind of color coordinated. And if you look at the blue, it shows Logan County in there and also Mason County. So those are the counties that Family Guidance is currently covering. Did they add Menard County? Is that in there too as well? Yes, okay, so Menard County too, because I know that was a new one that we just added on to that. So this is what it kind of looks like. And we're hoping that we're going to be able to get coverage in all the counties in Illinois. But right now, this is what we're really focusing on, are these counties right here. And Family Guidance Center, in partnership with Spokes, is working to expand evidence-based medicated assisted treatment to people who suffer from opioid use dependency through the Hub and Spoke program. FGC acts as a hub and is responsible for coordinating care and support services for patients with substance abuse disorder and or co-occurring mental health conditions. The spoke will provide medical, dental, and behavioral services to the patients. The Hub and Spoke program is supported by a grant from the U.S. Department of Health and Human Services, Substance Abuse and Mental Health Services Administration, so SAMHSA. Priority access to program is given to the residents of Sangamon, Christian, Morgan, Logan, Menard, and Mason counties. And then now for training and technical assistant programs, we are utilizing the RLC, so the regional leadership centers, to provide technical assistance to the hubs and partners of the network developing, including helping hubs identify new potential partners. Also utilizing the Rush University Opioid Use Disorder Treatment Fellowship programs. So they do a lot of the trainings for like the doctors and the providers and different things like that. So we have some assistance with them as well with this. And then the goal is to develop a system of care for people with opioid use disorder, including the provision of counseling, care management, and recovery support services. Also, we're trying to increase the MAR availability and reduce the treatment deserts, reduce the number of people living in counties with no medicated assisted recovery, provide access to all three forms of MAR through expanding and enhancing the availability of buprenorphine and naltrexone providers and linking with existing methadone providers, and then coordinate the MAR services, developing linkage agreements with hospitals, emergency department, designated a medical champion to provide expertise and leadership on MAR services, and to create a community-based advisory council, and offer coordinated and integrated healthcare systems and collaborations with these health service providers. And then this is the contact information, me and Jenna stuff. And like I said, this is a lot of information, guys, and I can just kind of give you the gist of it, just to kind of simplify it, to kind of paint a picture for you guys of what this looks like. So with Hub and Spoke, what we do is we go into these desert counties, the counties who are not currently providing any type of medicated assisted treatment, whether that be Suboxone, buprenorphine, Vivitrol, anything like that. And so what we do is we want to try to work with the healthcare providers there, linking up with the public health departments, the hospitals, different things like that. And we want to try to link with these doctors or the nurse practitioners or anyone who kind of prescribes these types of medications, and to be able to provide some type of service and care, and not just the medication part of it. Because a lot of people just think that, that MAT services is just about medication. They leave the treatment part out of it, the counseling piece of it, linking them with different resources out in the community. So with Hub and Spoke, what we're really wanting to do is we're wanting to go into these counties like Logan County, Mason County, where there's not a lot of services, and be able to provide some treatment services to these counties. And like I said, we've had some success here in Sangamon County with the Hub and Spoke program. We've been able to link with Central Counties, who was a buprenorphine prescriber, and they really had some good stuff going on. But and me and Jenna talk about this, and Sangamon County is pretty already well established. So when we go into like these desert counties, like Logan and Mason County, and these places where they don't have a lot of services to them, that's what Hub and Spoke was initially created for, was for these counties who don't have the services, and we're able to bring those services to them. And with Hub and Spoke, we are able to deliver services as well. Like if we need to bring a counselor over to do counseling sessions, if someone's going to be prescribed buprenorphine or naltrexone or something like that, we can provide counseling services as well. And then also there is monies available to help with providing staff, like if it's just some type of private practice or like a public health department or whatever it is, to be able to hire staff to help with this program, because, with the doctors and, nurses and stuff like that, who's going to pay their salary if we pick some of these people up, you know what I mean? So we're able to do that. So that's kind of the gist of it. And then also Family Guidance Center is here as a resource. We have residential treatment services here. So, anybody that's needing treatment, or if you guys know anybody, because trying to wait 6 to 8 weeks to get somebody in a treatment is quite a long time. Some of these waiting lists, these treatment centers are fairly long. So just another resource for you guys. And I'm just happy to be in these counties and bring you guys these services. And that's all I have. If anybody has any questions, let me know. Feel free. Hope I didn't talk too fast.
That was great, Andrew. Thank you so much.
Okay.
Yeah, we're so excited to have you in the community. doing our needs assessment, we did find that there was, that was a lacking area is medicated assisted treatment or recovery. And having you guys come in and help us with that is going to be amazing. Getting people the help that they need and in a timely manner is also so important, as you said. So we're so excited to have you. Do you need anything from us? I know you're going to be going knocking on doors with some people in Logan and Mason. Anything you need from us when you do that fact-finding mission?
Okay, no, not really. Like I said, and I just wanted to kind of use this as an introduction piece because I am going to be kind of digging around Logan and Mason County. So if I come to your guys' office or anything, so you guys kind of know who I am. So I'm not just some stranger from Springfield coming in and digging around in your guys' towns and stuff like that. Because I've visited Lincoln and I've met with Jeanette Harris. So I've been in Logan County. I really haven't had a chance to get into Mason County yet. So I look forward to meeting everyone, because I like to travel. So I'm on the road a lot, as long as the state is still open, they allow me to go places still, because that's something fairly new to me. This virtual world is because all of my service has been in person through the pandemic. I didn't have to work from home or anything through this whole thing. So it's been pretty cool with that. So I look forward to meeting everybody in person though. And I think that's all I have, unless anybody has any questions in regards to Hub and Spoke.
Hey, Andrew, I appreciate you sharing the information. This is a promising prospect. I guess I'm curious. So would Family Guidance Center come and basically, for lack of maybe more sophisticated term, like run a clinic for part of a day in one of these deserts in a locale that doesn't have MAR services currently? So you would show up on site for, let's say, 8 to noon at whatever desert town this is and run a clinic.
So what we would need is we need a provider that's from the county.
Mm-hmm.
So that's what we really were trying to target here now, is we're trying to find doctors, nurse practitioners, anybody, because you don't have to have the waiver anymore to prescribe the buprenorphine.
Mm-hmm.
So even if that's educating people, I've gotten with Angie from over at Abraham Lincoln, with the hospital, I did something with her. And so that's what we really need. But once we find a provider who is willing to prescribe the medication, and then we can provide the counseling service, the treatment services on that part of it. If that makes sense. Did that help answer your question?
Yeah, sure. Because that was
Okay.
another question I had written down, which was about so what recruitment of a spoke site would look like. And so you're suggesting that the spoke site you'd be recruiting not just the site, but also a provider on
Correct.
site.
Yes.
Okay. And
so
then you all would build out the suite of services provided to include some other counseling and treatment.
Correct. Yep. You
aspects
nailed
of
it. Yep.
Okay.
You got it.
Cool.
Yeah. And I think that's that's kind of the barrier that I'm running into now, is trying to find a provider that's comfortable prescribing the buprenorphine or the naltrexone. Because like I said, and I want to try to start educating these doctors and nurse practitioners more about medicated assisted treatment and how it saves lives, and what it does, for people. Because I said, I think there's more of a liability fear of prescribing these things, because they sometimes do it in the emergency room, but they just give them a couple of day script and then they just cut them back out into the community, and soon there's no follow-up with that. So like I said, that's what we were trying to do. So if you guys know of any providers or any type of doctors or nurse practitioners that are currently prescribing buprenorphine, please, notify them about this, because we can do the accountability part. Family Guidance Center will do that, working with the doctors and stuff about it, and, continuing on with the treatment part of it.
I have a question.
Yes, ma'am.
So I thought that SIU has a Suboxone program. They send their Lincoln patients to Springfield. Why can't the Lincoln SIU doctor be that person? Josh, can you address that?
Yeah, it's a keen observation and a pressing question. Similar words have come out of my mouth in kind of internal investigations within SIU, and I'm kind of early on in in gathering a kind of an accurate snapshot of the landscape in terms of providers' appetite to join in on this campaign, this type of work. So that unfortunately remains to be clarified a little bit more for myself, and then as I would be able to share out to y'all. Go, Angie.
I'm going to piggyback on what you said, Josh, because serendipitously, I just spoke to Hoagland. Well, I talked to these guys yesterday, but then I spoke to Melinda Hoagland later in the afternoon because I had a phone call. Anyway, the point is, she is looking into it. She's the nurse manager for the family medicine in Lincoln and all the outreach places. And she's looking into it because I have also posed that question. So Josh, I wanted you to be aware that I don't know if where your questions are trickling to, but Melinda Hoagland's out there hopefully trying to find some information as well.
Cool. And I'll say that my trajectory of approach is through a the family medicine clinic in Quincy, and kind of a champion of MAR, at least there, a prescriber, Dr. Michael Connolly, who also is now quite experienced in providing provider trainings, X-waiver trainings when X-waivers were necessary. And so he's really involved in, I'd say, just generally capacity building for MAR. And so that's like I said, that's been my pathway of inquiry to try to understand within SIU medicine, his and my colleagues, and then what's going on in other of the clinics, and maybe how can we bend some ears. There we go.
Yeah. So I've got a question. This is Sue. So outside of Mason and Logan County, I've got rural areas that do have a prescriber. Example, Fulton County, I have a Suboxone prescriber, but we do not have per se wraparound services to reinforce that. Is this something that your organization offers as well, or is it only for the aforesaid counties?
Well, right now it's for the before said counties, but we are willing to expand services. I don't believe that would be an issue. So I'm going to go ahead and I've made a note about Fulton County. So, and I'm going to look into that and see, because we're always willing to expand counties and different things like that. There's plenty of money in the grant in order to expand services like that. So like I said, I appreciate you identifying that county, because that's the main goal. And I want to continue to reiterate this. Is like, if we can find somebody who's willing to prescribe the buprenorphine, we'll bring the services there. We'll bring, you know what I mean? Like, we'll bring the counseling, we'll bring the support services and everything to the county if the doctor, agrees to do this. So I'm going to really get into this. And if you can, will you leave your contact information in the chat box for me?
Sure.
All right, I appreciate you. Thank you so much.
Thank you.
Hey, Sue, this is Jenna. What county is that in?
Fulton.
So Fulton County, which borders Mason. And I know there's a few people from Mason County that I think see this physician. It's Dr. Bowers. He prescribes Suboxone and has been for, 3 or 4 years maybe, but it's Fulton County and we border Mason.
Hey,
thank
Andrew.
you so much. Yes, sir.
So I did this thing that I'm starting to get kind of good at, which is on these Zoom informational sessions, screen grabbing things of interest. And this might be a waste of our meeting time, but what's up with Wabash County, way off on the east side of the state? Like, how y'all running operations out there? It's like there's this this node of like contiguous counties and then way the heck off in the nether
Me and Jenna were
regions.
talking
It's
about
like,
that.
how do y'all manage that? No, for real, like, how do you manage that?
We don't know. That one just popped up there.
just
We don't
popped.
know why we have Wabash down there, really.
Because what we did was me and Jenna, we had to get some updated information on Hub and Spoke because we had some outdated stuff, and these grants continue to evolve and they continue to add more things to it as the grant evolves. So this is the newest information that we've received, and they just popped that county up on us like, oh, well, that's new, because we knew about Menard County being added. I knew about that, but like this other one, and Jenna was like, what is this over here?
Yeah.
And I was like, I don't know. So, but
Outlier.
yeah,
Yeah.
so
We'll
I'm
be
gonna have to
exploring.
reach out there.
We'll report back and we'll be exploring that
Cool.
for you, Josh. Okay.
Yeah, it sounds like we all have some stuff to report. And then Sue, it sounds like, or from what you all are commenting, Jenna and Andrew, that like expansion into Fulton is perhaps pretty feasible.
Yes.
Yeah. It's like, and it's similar to what I see with Chestnut, which is like Chestnut's got a big old swath, and then very bottom of the state, there's this one county. I don't know which one it is, but it's way down there. So it's just interesting, these islands. Anyhow, that's just an observation.
Yeah.
All right.
I'm Deborah, and I got a question.
Hey, Deborah.
I deal with a lot of people in my home, probably about 15 or 20 in the last year. And my question is about the alternative methods of treatment with medicine. I've had a lot of relapses when it comes to methadone and all of that, Suboxone. It seems like all of those individuals don't seem to get on the right track. Is there a program that associates this with getting them the help they need as they're on these medicines?
Yeah, so that's kind of the program that Andrew was talking about. So some doctors are prescribing these medications and not providing those wraparound services. So kind of the exterior support that you need, counseling, all that kind of thing. So that's why these spoke programs are so great, because they're bringing those programs in and not just writing a prescription. So that's why we're so excited to have Andrew and the Family Guidance Center there to help people, not relapse and everything like that. So
like you got a place to send them, like if something happens when I've got them here, they got an alternative place to go that may be able to help them.
Yeah, and so go ahead.
With the situation they get themselves into.
Yeah, and Deborah, and especially with Family Guidance Center and you being able to utilize their services, because especially in these counties that I identified in, and it talks about, having first access to it, that was part of it. So the priority access to the program is given. So whether if they need residential services, if they're needing housing or anything like that, you know what I mean? Like we'll be able to provide those wraparound services for them. Like if they need a higher level of care, if they're just doing, outpatient services with the medicated assisted treatment, yeah, we're able to provide them with a higher level of care. And then if they need to be placed, if they're having barriers with housing or transportation or whatever it is, we're willing to help and provide those services to the individual.
Okay, that's what I was wanting to know, because I get a lot of them here that stay here, but when they relapse, it's almost kind of like I can't keep them here.
Well, make sure you get my information down, Deborah, and you just call me. My cell phone number is on there, and if there's someone who needs a need of residential inpatient services, just call me and I'll get them right in as soon as possible. Okay. We don't have a 6 to 8 week waiting list over here at Family Guidance Center. Okay. And we don't care about what type of insurance you have to get you into treatment as well. Okay.
All right. I appreciate it. Thank you.
And just kind of a heads up right now, guys, here at Family Guidance Center, we do have 8 open female beds right now. And that's kind of a hot commodity. If anybody's worked in the treatment field before, getting females into residential treatment. We have 8 open beds right now for females. And like I said, if you've ever worked in the treatment field, those female beds are the first ones to fill up. And we have 8 openings right now and 2 males.
Thank you. All right. So I'll send out Andrew's contact information in our follow-up email that I send with all the notes and everything. So people can contact him directly. As he said, and then he'll also be on our future meeting. So he'll be around. All right, we'll get going on the next part. Can you guys see this?
Yes.
Okay, excellent. Still new to the Zoom. Okay. Okay, I think most people here have been involved with the ROSC before. So we'll kind of go over this throughout. So who is involved? Everybody here, all community members. We have people from the recovery community involved, as well as we would love to have, law enforcement, business owners, just everybody across the continuum, because everybody has a foot in recovery. It's the whole community. Let's see. So as we went over last time, we did the community needs assessment overview where we went through the survey. So we do have Nell here, who is an expert in the field. So she is going to give some of her insights about the needs assessment. We are finalizing the document. We'll have it turned in September 1st to the state, which is one of our ROSC deliverables. And then we'll be making an executive summary, so a 1 to 2 page document that we'll give to all of our community members and hand it out at our different events. So it's going to be more easily digestible than our 30-page, really long document. So go ahead now.
Thanks. So I'm just going to give a very quick sort of general overview. And I think Rachel or Jeanette talked a little bit about this at the last meeting, which I wasn't at our last meeting. So I'm not going to go into too much detail. I have a feeling that Rachel talked about methods and those types of things last time. But just as sort of a refresher, we created a digital survey. We did both a digital survey and hard copy surveys that we handed out to people at various locations in both counties, Logan and Mason counties. The goal was to have people complete 250 surveys, and as of the end of July, I think we had 363 surveys. So really a great response. People were interested in weighing in on this issue. The survey asked 26 questions, and it covered awareness, access, advocacy, and then just kind of generally what we called opportunities for growth. And the good news is, I'll start with the good news. Although in some ways Mason and Logan counties look very much like recovery deserts, there are a lot of strengths. And in terms of one of the things that happens with a needs assessment is that you're often able to sort of gauge and assess a community's level of readiness for doing this kind of work. And the community is pretty ready. People are aware of the gaps and the issues, and they want to see good things happen in these regions. There's not as much, denial, I guess, and, there's stigma everywhere. But the community is really looking for ways to partner and collaborate and make things happen. So that is the really great news. The not so good news, I guess in some ways it's good news because now we know from doing the survey kind of where we actually stand and not just where we think we stand. But we do need more collaboration. We need to start filling in some of those gaps. We need more programs like the one that Andrew just talked about. And it's kind of across the board there, almost in every category, people were responding, both in awareness of the lack of resources, but also the desire to have those resources. So sober housing, transportation, outpatient treatment, family services, drug courts, kind of all of it. So as Randy mentioned, we're just in the final stage of kind of wrapping up the report, and we'll be distributing it. And then the other thing is that we are creating with you all sort of a strategic plan for year 2 based on the needs assessment. So it is giving us some really good data and information. Nothing that is really a big outlier or surprise, but that's okay. That's good news too, or good to know. So yeah. Any questions for me? All right.
All right, thank you, Nell. Yeah, that's excellent. So as I said before, we have that needs assessment. We are going to make that executive summary probably more people will want to read. It'll be much shorter, easily digestible information. And then we can use that going around the community to kind of, if people are asking about the project or what our goals, that kind of thing, we'll have that written down. There we go. Okay, so we talked about this at the last meeting briefly. We're going to start doing focus groups and key person interviews coming up, since we do have some events in September, which is Recovery Month. We're kind of pushing this off until October when we get kind of our fully staffed back up. So these folks, I said, in October. So we're trying to fill in some gaps that we identified within the needs assessment and details, because we're going to get so much information talking to people, more than just those 26 survey questions could kind of give us more open-ended questions, which is excellent. And then we are going to be doing these virtually just because of COVID numbers and proximity, all that kind of stuff. We'll have a variety of different times available. So probably like early morning, lunchtime, afternoon, evening, and maybe even the weekend. If we get that feedback that people would like to do it on the weekends, we'll kind of be open with it. We'll have 6 to 12 people per focus group. And we would love to have people with lived experience do this. Those are the individuals we really want to reach. We want to know, their experiences in the community, trying to go through recovery services, living in recovery, any stigma that's going on, and we want to know everything. So we will have some gift cards or other incentives, especially for people with lived experience. So if we want more information, we have everybody listed that got the invite to this. But if you know anybody else, they can email us, or we have our phone numbers at the end, very open, and we can work with their schedules as well. We'd just love to hear from them. And then, if then anybody else we should contact to get involved with that, please just let us know.
Hey, Randy, real fast, yes. I'm wondering, so I think it was Nadia who sent out the larger needs assessment findings, the report. Mm-hmm. And is Chestnut, are y'all still soliciting comments, feedback, or is that window closed? Yeah, definitely. We can still have some. So Nell is going over it with like a fine-tooth comb right now, making sure everything flows and doing all the hard stuff for us, really. The nitty-gritty, but yeah, definitely. Yeah. If you have comments about anything, we will still take those until probably end of August, because it's due September 1st. Great, thanks. Yeah, thank you. Okay, as I mentioned before, September is National Recovery Month. So we are hosting the 2 recovery walks, one in Logan County and one in Mason County. I just wanted to ask the larger group, anything else that we should be doing as a community. We will be posting like on our Facebook page, promoting recovery. But I was just wondering if anybody in the community is doing anything that you want us to promote, or anything else we should be doing.
This is Angie Stoltenberg. I will let you know, and it might not be as exciting to everybody else as it is to me, but because I have the remote control that can do it, our fountain at the hospital is going to be purple during the month of September. So that's amazing. Wow. I'm happy. We'll have to go take a picture of that and put it on our page. When I could do things like fly a pride flag or do a purple fountain, these are the things that make me happy. So there you go.
Yeah, that is awesome. Thank you.
Thank you.
Okay. And then I was just saying, the recovery walk. So we have been having some planning meetings for that. We actually have one right after this one. If anybody would like to come that does not have the invite, you can reach out. So we have put up these flyers in a lot of places in Logan and Mason County. Obviously, we can't reach them all, but we tried. Hopefully you've seen them kind of around. We put them in community gathering spots, gas stations, food places, all that kind of thing. If you want a stack or anything, just let us know. We drive around the counties relatively frequently, so we can drop them off at a central location like the library or to wherever you are, if you'd like to do that. We also have the PDF version that I believe I sent out with the invite, but I can also resend it if you'd like. So the subcommittee has been working very hard. I'm very grateful for all of you that have been helping with that. There's a lot of things we got to check off, and we're getting down the list, which is great. The food will be donated from ALMH via Angie for the Logan walk. And then we're still working on the Mason walk, but we will have food there, probably like a light lunch. And then we ordered wristbands. So some like jelly wristbands, which we'll be giving out. So we'll have like 250 of those. And then we'll have a big vinyl banner that we'll be hanging up. Just says, let me go back. So it just has our logo like up here at the top, promoting our event. And we're seeing if we can put it up a couple days early to raise awareness even more the week of the walk, just have it up there a little bit longer, which will be great. And then we're having an open invitation for informational booths. So if you know anybody that wants to be a part of this, we are just starting to reach out now to different groups, but we love everybody on this meeting. If you're with an organization and you'd like to have an informational booth at one or both of the walks, that's an open invitation. Please just email me. My email's on there. If you'd like to reserve your spot, it's pretty informal, but you can have a spot at the walk. And then does anybody have a better idea of like a way to get the word out? So we've really just put up the flyers, but I know different communities have different ways of getting out information. So does anybody else have a better idea of how to get the word out?
Social media, radio, newspaper isn't so much of a big thing, I think, for a lot of people anymore. Our biggest success in Fulton County, for me, has been flyers out and then social media.
I was going to, if I'll follow up with what Sue said, while print paper is not necessarily as effective of a way, most newspapers also have a digital thing that might like be just a little bit more visited than the print versions of things. And there's this other thing I heard of recently. What's it called? Facebook. I bet you everyone in here probably has a little profile. So yeah, like Sue was saying, social media for sure.
And the online papers are very good about printing a press release, especially of that nature when it's more of a community event. They'll print it. So that would get the word out. Also, while I have the microphone, I had sent Nadia and Angie a thing about t-shirts. I went to Hot Frog, whatever they're called, and they're doing me a promo because we are going to buy a couple shirts for our drug court clients who are going to participate. So if anybody's interested, we can get a t-shirt with that National Recovery Month logo, and they'll be purple.
That's so cool that you're going to have drug court participants.
Definitely take your flyers like everywhere, places that you don't even really think about, laundromats, gas stations. Of course, ask permission, excuse me, first. But we tried to just plaster them wherever we possibly could. And most places are very receptive, especially when it's something positive like that.
Have people in the county seen them? Because we did that. But if we need to put them up at different places, please let us know.
Oh, thank you. Yep. So the t-shirts, we'll send out an email with that. So Kim, for those, how many, so we're ordering them before the date, correct? So when would be the last day we would have to get our order in?
They told me that September 7th, they could turn it around and have it for that day, would be the latest.
Excellent, thank you. Yeah, so we'll have to order those. We'll send it out in an email. If anybody wants to order those before the date, so we'll get them out. Let's see. Oh, and then we're also having speakers at the walk. So we have a couple of speakers already chosen, but if you know anybody else that would like to tell their story, a quick 5 to 10 minute during the event, either their recovery story, their, losing a loved one, anything like that, that they would like to tell everybody at the walk. We're kind of having people come to us. We do have Logan pretty good right now. We are still looking for some speakers for Mason County. So if you know anybody with lived experience, anything like that, and they would like to speak, please let me know. We can get them plugged into that. Okay. So our next meeting, oh yeah, go ahead.
I'm sorry. This is a regression of sorts, but I'll say that especially to Andrew and Jenna, perhaps, but to everyone. So SIU School of Medicine offers telephonic, virtual MAR provider. It's not just for providers, actually. It's pretty beneficial for, social workers, hospital administrators. They're all accredited. And there's a series, it's, I think, the first and third Tuesdays of every month.
Is it Echo?
It is Echo. So I think for you two, maybe, or for the group, but as you're prospecting and recruiting, and you might run into a provider that shows interest but feels like they might be underexperienced or underinformed about it and want to grow their understanding before they get into this thing. For sure, include that as perhaps some of the ways that they could get online. And I have a flyer. There's no way for me to attach in the text box, but I can send it out. I'll follow up and send it out to this group as an attachment, which is the promotional material for it's starting September the 17th, I do believe. That is me just working from my memory.
Yeah, thanks, Josh. And then also, I know Chestnut Health also does some trainings in regards to MAT services as well. So, I would just take as much information as I can to kind of, help out some of these providers that are kind of, apprehensive about prescribing the medication and different things like that. So I'm willing, like I said, I'm willing to do whatever it takes, to get them on board. Because man, and I think it's just kind of the culture of the doctors and different things like that, what's going on. Because me and Jenna really spoke about that this morning, that they, I wish, especially through SIU, because they do a lot of teaching, a lot of, like the school and stuff. And, it'd be awesome if they could come into treatment centers and kind of do like a teaching thing. And Family Guidance Center is more than welcome to be able to have them come in and do something like that here at this facility as well. Me and Jenna were talking about that along with our VP here, and then be able to provide services like that, as a educational piece for the students, the doctor students and stuff. So, hey, we're open for it.
Yeah, maybe we can arrange a I don't know, either like a half day or a lunch and learn or something for perhaps interested but unsure. And when we talk about stigma, it really it's reflected in the providers' reluctance to touch this thing. That's right, yeah.
And then right now, also, when we're talking about stigma, Jenna's been working on this anti-stigma campaign I don't know if you guys in these counties for Mason and Logan, some type of anti-stigma campaign. Jenna, do you want to kind of talk about that real quick?
I don't know, do we have time?
Yeah, we do have time. I just have like a minute or two of stuff left, but yeah, definitely you can
Okay.
talk.
Yeah, so the ROSC Coalition is a part of a anti-stigma campaign out of LA. It's called Faces and Voices. And they're doing some really interesting things. I've been participating in those subcommittee meetings for the last couple months. So when you're driving around Illinois in September, make sure that you look for purple because I think that there should be some billboards and other things targeting anti-stigma or targeting stigma. And that's really exciting stuff. We have a long way to go with anti-stigma committees in regards to substance use disorders and mental illnesses. That's not going to change overnight, but I think if we all continue to push these messages and destigmatize some of these substance use disorders and mental illnesses, it's only going to make better for your community. Josh, just to re-round on that, in my history, in my experience, I worked at an adolescent hospital, and it was for pediatrics and adolescent youth, acute psychiatry. And we would have teams of doctors. We would have like a lead supervisor provider who would come in and be the teaching agent, and they would use our facility to teach them about childhood psychiatric issues. And what a better place to teach at is this location right here, because you see everything. So it would be something that we would probably be willing to do. And then, hey, Angie, I wanted to give you a shout out real quick. I followed up on our conversation with Ron from yesterday, and SBIRG grants currently cannot go into Logan or Christian counties. However, we're talking with the state to see if we can get more funding for you, okay?
That is outstanding. Thank you very much.
You're welcome. That's all I got.
Awesome. Thank you. Anything else before I do my last couple points? No? Okay. So as I said, our next meeting is Thursday, September 16th at 2 p.m. So the third Thursday in September. That'll be right before the Lincoln Recovery Walk, which is on September 18th. So we'll have our final plug for that. And then, as I said, the ROSC Recovery Walk planning meeting is meeting right after this at 3 p.m. If you'd like an invite to that one or any future meetings, please just email me or tell me at the end of this, and I can send you that Zoom link. We're just kind of divvying up duties, getting everything, the timeline of the day, knocked out and all that kind of stuff. And then our homework for our next meeting that I want everyone to start thinking about is, where do you want to focus your contribution to the ROSC Council? So one of our goals when we are strategic planning is making up subcommittees so we can kind of meet more frequently than once a month in those smaller groups. And we kind of like to focus on the areas that we identified in the needs assessment. So awareness, access, advocacy, and opportunities for growth. So they can be more general subcommittees or kind of more pointed. So like right now we are doing this recovery walk subcommittee. So maybe in the future we'll make it like a special events subcommittee where we kind of plan candlelight vigils, the recovery walk months before instead of, a month and a half before. We'll get it started earlier and all sorts of different stuff. Some other identified areas that we might want to focus on are stigma reduction. Jenna talked about the Faces and Voices of Recovery, which is an excellent organization. If we can get something more in our town, the community buy-in with that would be amazing. If we can come up with something like that. Stigma reduction is hard to pinpoint, so you have to come at it from a lot of different angles. Another area is transportation that we identified. Having family guidance come in and bring some of the services to the community will be excellent, kind of reduce the need for transportation, but there is always that barrier in rural areas. And then also sober living houses is a need that was identified in a lot of our surveys that we sent out. So maybe creating transitional housing, talk about getting an Oxford house in the future, all sorts of different things. So there's just some of the ideas I want you guys to think about, where you would fit in to the subcommittees, what you're passionate about, all that kind of thing. So we'll touch base at the next meeting on that. And then I also just want to say, so Jeanette will be out until about mid-September. So I know a lot of people just contact her directly. So in the meantime, if you can either send it to the Logan Mason ROSC Gmail account or to me or Nadia, just CC on us on the emails. That way we make sure that we get it in case Jeanette doesn't check her emails or something like that. That'd be great. Okay. Any final thoughts from anyone? Okay. All right, then that's it. Thank you everybody for coming. This was my first meeting I was leading, so I appreciate everybody.
Did great, Randy.
Being kind with it. Thank you.
Excellent facilitation.
Thank you. Thank you very much.
Thanks
I tried.
to Andrew and everybody. Bye,
Go,
y'all.
Randy. You did good.
Thank you. All right, and then did anybody need the link for the recovery meeting after this, or you already have it? All right, good. All right. I'll see everybody at that in a couple minutes then. Give you guys 3 minutes back. Thanks. Bye.